Is it safe to get a chiropractic adjustment when you have spinal stenosis? People get told, don't get adjusted, it's going to hurt you. People get told, it's the only thing I can do because it helps me move. What do you do? Are you confused? Watch my video today. I'm going to explain the chiropractic adjustment, I'm going to explain spinal stenosis, and I'm going to explain what the chiropractic adjustment is meant to do and not meant to do. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic Wellness Center. And our mission on this channel is simple. It is to help teach you how to optimize your health, how to live life to the fullest, how to live life without invasive procedures or surgeries or pills to start maximizing the inner potential you have. So watch this video in its entirety. If you're interested in learning more about your health and how you can maximize your potential, then subscribe to this channel, like this video. You will be informed on when I actually post out new videos. This is all about you and about living your life. So if you're interested in maximizing your potential, watch this video in its entirety. Let's start. So the question is, what is the chiropractic adjustment? How does it benefit? What does it do? Does it even benefit? Let me explain the chiropractic adjustment. First and foremost, it's not about forcing bones into place. It's not about opening a joint space up aggressively. And it's not about chasing pain. This is what it is. It's about restoring motion in an area that's restricted, okay? It's about reducing the abnormal joint tension that is there, and it is about improving the connection between the brain and the body. This is an important distinction when it comes to chiropractic. It's not about a fix, it's not about a cure, okay? But it's about improving your tolerance. It's about managing your symptoms. It is about giving you better mobility, and it can be a game changer for people that have spinal stenosis. So the understanding first, when somebody comes to a spinal stenosis, is understanding what spinal stenosis is. Stenosis means narrowing, and where the narrowing is it could be either in the spinal canal, and that's where the spine comes down, the nervous system, as well as it could be in the foramen. And the foramen is the hole on the side where the nerve comes out. So either of those areas, those canals where the nerve comes out or where the spine is going down, can be decreased, can be smaller. And this can be due to a lot of different things. It can be due to inflammation in the area. It can be due to scar tissue in the area. It can be due to arthritic wear and tear, degenerative joint disease, degenerative disc disease. It can be due to disc bulges that are going on. The list is endless on what it could be. And so that's an important thing to understand, is that which spinal stenosis do you have? Canal spinal stenosis? Do you have a foramen spinal stenosis? Now, with that being said, the chiropractic adjustment is extremely important because the chiropractic adjustment is there to help improve the motion that is restricted in that joint. And what can happen is that when these joints have a lot of motion, these joints can get misaligned. And when they get misaligned, you got to think about that suddenly that area where that nerve is coming out can start to get decreased. And guess what? That is affecting that nerve that's coming out. The canal has just gotten smaller. Scar tissue forms in there. But then also, I see patients coming with disc bulges, muscle guarding, inflammation and stuff. And that can be all due to that joint irritation. And suddenly, when we start to move these joints back into place, we take that pressure off that nerve. We reduce some of that inflammation that's occurring in that area. And this can affect not only the nerve, it can also affect the spinal cord. So it is a game changer for people because it helps to reduce that inflammation. It helps to improve some of their symptoms. It helps to improve their mobility and their function and the ability to be able to do things back into their life. So when somebody comes with spinal stenosis, I'm assessing a lot of things too. I'm looking at how their hips are, how they're level, if they're off. I'm also looking at their posture. I'm also looking at them as they're walking down the hallway to the assessment room. When they're in the assessment room, there's certain tests that I do that I'm looking at coordination, balance. All of these things play a role in terms of how severe the spinal stenosis is, where the spinal stenosis is affecting, but how it's affecting their motion and their function and their ability. And that gives me a general idea of what I may be working with and what I need to improve on too. So what you're going to see here now is the chiropractic adjustment. How do I deliver an adjustment? Now, when somebody comes to a spinal stenosis, you'll see one of the things I'll be checking with all patients, I'll be checking things like their leg length. So you'll see my hands on their ankles and stuff, and I'll be assessing those leg lengths, and I'll see how those leg lengths are. It gives me direction in terms of where I need to adjust. When I'm adjusting a patient with spinal stenosis, I can be adjusting with drop pieces. And the drop pieces are a gentle way of adjusting that patient that absorbs that impact, that allows me to adjust them. So you'll see the pelvis adjustment with drop pieces. You'll see the thoracic adjustment with drop pieces and stuff. And now, can I do a manual adjustment? I can, but it really depends on tolerance, on what that patient can handle. And I can do many different techniques, but it's finding the right technique for the patient. And not every spinal stenosis patient that comes in is going to need the same technique. There may be modifications, variations, which I can do, and that's important. But it is about gentle, precise movement, nothing aggressive, nothing forceful, nothing that's going to aggravate that condition, but to help more or less improve the mobility and the function within that patient. And that's a game changer. So what I'm going to show you here today is the Thompson Terminal Point technique adjustment. This is a great technique to use. It's an analysis technique. It tells you exactly where you need to adjust. And this is great for a practitioner. When we're coming in there, our questions are, number one, when I adjusted you before, was that adjustment holding? Well, I'll be able to recheck on this and see, is that same presentation there? And is that adjustment holding, or do I need to readjust it? With that being said, it also helps me pick up new presentations. Is something else misaligned? Is something else out? So without having to do a full testing all over again, I can do this analysis technique and it can tell me where I need to adjust. And that's an important thing. Plus, at the end of the adjustment, I can make sure that everything is holding and it's fully adjusted. This is a fantastic technique. Now, this technique is built on a few things. Number one, it's built on the drop piece table. It's one of the ways you can adjust a patient is with the drop piece table. The drop piece table is the table that has air compression drops in there. So these air drops help to absorb the impact of the adjustment. It makes it extremely gentle for a patient. And more importantly, the patient just stays in this position. And they are in a position where they are prone and they will be relaxed. There is no movement. There's no twisting, nothing. Just a very gentle position to adjust them in. Now, let me show you what the Thompson Terminal Point technique looks like. So one of the things I'm going to be showing you here is how do we check the leg lengths. And the leg lengths are important for Thompson Terminal Point technique. It tells us exactly where we need to adjust, how we need to adjust it. And what I mean by that is the first thing I'm going to be looking at is the leg lengths here, okay? And I'm going to be looking to see the bottom of the shoe, but I'm looking at this part of the shoe. This is the part that doesn't erode when a person is walking. So when I look at this, I'm looking to see, is one leg shorter than the other? Now, when you look at this, you'll see that this leg is shorter than this leg. So that means the left leg is shorter than the right leg, okay? So we have a left short leg. The next step, after I've identified that we have a left short leg, is I want to see when I flex the knees, does that left leg stay shorter, become even, or get longer? Let's take a look and see what it shows. So you can see how that left leg actually becomes longer. Okay. So understanding that tells me that this left leg here went from short to long. Okay. And when I understand I've gone from short to long, I know exactly where I need to adjust, and that is the left pelvis area, and it's the ilium portion of it, and that's gone posterior. So that's the area I'm going to be adjusting. Now, you'll see I crossed one leg over the other, and the reason why I crossed it over the other is it helps to gap the joint. It makes that adjustment a lot easier. And then I place my hands on here, and then I'll adjust through. And that is your pelvis adjustment. Now the next step is, let's check the leg lengths and see if they've changed. So now let's check these leg lengths and see how they've changed after the adjustment. You can see how they've become level now, okay? So that means we have adjusted that pelvis. We want to double check with bringing the knees up. And again, see how it's a lot better, okay? That is a change that's been made to that nervous system, okay? And so we have adjusted that pelvis area. So the next part of the adjustment is going to be the thoracic adjustment. And we're going to use the drop pieces for this. So again, the drop piece will absorb all the impact. I will adjust the table settings so that only the thoracic area comes up. And what I'm going to do is I'm going to find where I need to adjust. And then once I've found that, the drop piece will absorb the impact as I adjust that area. So now I'm going to show you how I adjust a cervical spine with the drop pieces and stuff. So I'm going to get my patient to turn his head to this direction. Okay. He's going to stay in that direction. I'm now going to adjust the drop pieces accordingly. So only the upper thoracic part and the cervical part actually come up. Great. And once we've done that, I then come in, I find where I need to adjust. I pretty much have contact on that area. This hand is just gently on the head, and then I adjust through. So when somebody gets adjusted with stenosis, they may notice some improvements. And the improvements are not because we're curing the condition. We're not. We're not fixing the condition either. I don't think anyone can actually cure or fix it. But what you're seeing the improvements from is that the muscles are guarding less. They've become relaxed. The motion is now starting to be restored within that joint and that spine, and they're able to move better. The brain-body connection is now restored. So that nervous system is now connecting to that body better. And so they're functioning better, they're thinking better, they're doing things better. The load that is distributed in their body is now even. They're actually walking better, they're standing up straighter, their posture is starting to improve too. And the symptoms can start to decrease. In some cases, it can be extremely fast. It can be right there and then it can be immediate. In other cases, it is gradual. Now, I want to clarify something. Spinal stenosis, when you come in and you get chiropractic adjustments, it is not a one-time episode. It is not one adjustment and suddenly you're remarkably feeling better. I wish it was that way. I wish I had a magic wand that I could just wave across somebody and instantly get them feeling better. It takes time. There are consecutive adjustments. It is a gradual process. And you've got to think about this. Spinal stenosis took time to occur in your body. It took years to develop. So the chiropractic care is something that is trying to restore that motion. And one adjustment is not going to miraculously do it. But over time, the gradual adjustments, you start seeing you're functioning better, you're moving better, you're living better, you're able to do things better. You're managing your symptoms better. You're getting things back into your life and you're living with better confidence and less fear. So when people ask me, is chiropractic care important and should I be doing it? I'll always say a resounding yes, but I have an understanding of why it helps you. I know it. I've seen it in my practice. So I would encourage you, if you are seeing a chiropractor, continue seeing them. If you're not, it's time to start seeing one because it could drastically help you with your spinal stenosis. So this video is part of a whole series I'm doing on spinal stenosis. So make sure you watch all the videos that are here because I teach you all kinds of different things in every video. It's all relevant. And if you found this video helpful, make sure you like this video. Make sure you subscribe to our channel. My name is Dr. Ali Shariff, and my clinic name is Infinite Healing Chiropractic and Wellness Center. And we are located in Oshawa, Ontario. And we have a busy practice, and our mission is simple. It is to help optimize your potential, help you be the best you can be. So continue watching our videos, continue learning more. I look forward to seeing you on more videos and educating you. Thank you.